Now, from Matters Trade on to Matters Health, where you can also be a part of the conversation, be using the hashtag #morning@NTV. Now, the World Health Organization has estimated that 1 million new sexually transmitted infections occur every single day. This means there are more than 376 million new cases annually of 4 infections, one being chlamydia, gonorrhea, and syphilis. Now, the report released late last week suggests around 1 in 25 people globally has at least one of the 4 STIs, with some experiencing multiple infections at the same time.
Well, experts are particularly concerned about the rise in drug-resistant STIs. The World Health Organization says practicing safe sex, particularly through condom use and better access to testing, are both crucial. Today joining us is Dr. Richard Kalungi. I want to call you a Rotarian because you're a Rotarian. I don't know why you omit that from your introduction. Rotarian doctor, which one comes first?
Usually when we become Rotarians,
you drop all the other.
We get a lot of humility. We just used to be called Rotarians. Even if you're a professor, doctor, so and so, reverend, you're Rotarian, so and so.
The doctors, those ones are drops.
Yeah.
Kari, this morning we have Rotarian Richard Kalungi. You are attached to Home Doctors Uganda. Let's start with the symptoms. How does one know they have contracted an STI? Meanwhile, good morning. Thank you for joining us.
Yeah, good morning, Rita and David. And thank you for having me. I think it's always a pleasure whenever I come to this show. In the past, we have discussed a couple of things, and I think it's something that should happen more oftenly. I don't know. I don't know. I come once in a while, but the topic that we're discussing is quite very passionate to me, both in terms of the work that I do. I love to call myself, besides all the things that you've talked about me, I love to call myself an international advocate for truths on health, or health truths, if you want. The truth in a sense that if such reports come out, they bring out the true picture. Truth in a sense that if there are health workers that manage disease, they're telling us the truth about our diseases and giving us the right things. Then the truth also in a sense that when patients are treated, they understand what they're being treated for. They don't self-medicate and things of that nature. So the report came out recently, and when I was contacted, I was very happy to share. In a sense that it's a true phenomenon. I don't know if you want me to go deep at this point, but it's true that the infections or the STIs are really going up. But before we go deep, we may need to understand what we mean by STIs, because there are STIs and STDs.
Yes.
And people love to confuse them with so many other things, like we shall see later. So an infection, like I usually confuse it so many, but an infection means that you've been attacked by a germ. Back in our science days, we studied about germs like bacteria, parasites, and all those things. So an infection means that you are affected by a germ. You may not have any symptom whatsoever. You may not have what we call in medicine a disease. When we say that you have a disease, it means that you have things that we can look at or see and realize that this person has such and such a disease. So we routinely use a lot of STIs because there are people who do not have disease, but they can actually infect so many other people. So it's safer to use STIs because it helps you to look out for these diseases before they even become diseases. So it's true that they are quite on the rise globally, but Uganda is maybe a little bit of a special case in maybe about 3 ways. One, when we look at diseases, we need to understand how they're happening in different geographical areas, because different factors lead to diseases coming up, and diseases are managed differently in different areas. So in Uganda, one of the things that we have commonly, I'm again so passionate about cancer, because cancer awareness, because of the work we do, the Rotary Cancer Run and things of that nature. And one of the cancers that is very common in this part of the world is cervical cancer. And actually Uganda ranks high in one of the diseases that one of the countries that have high cases. But when you look at cervical cancer, its genesis is a little bit linked to a virus which is sexually transmitted. And we are seeing so many cases coming up. But when you look at Uganda, like I said, it's not just about saying they have gone up. We need to understand which cases are we talking about. Are they true cases or are they false cases? And then the other thing we may need to understand is that some people here think that when you talk about STIs, you're talking about women. So it's the women that go into health facilities and they say, I have an infection. So you ask them what infection, and in essence, they think you should understand they're talking about problems in their private parts. But we need to understand that STIs or STDs affect both male and female, and they can even affect younger children. In a sense, for example, like if a woman is pregnant and she has gonorrhea, she can spread the gonorrhea to her baby. So you listed about the top 4, and I talked about chlamydia, gonorrhea. I saw missing out, struggling to say the trichomoniasis and the syphilis. But of course, we can't skip out the HIV. Maybe this story took a little bit of interest in those 4. Reason being, the HIV, yes, is well being taken after, cared, well being controlled, but there are equally new cases of HIV. But for this particular disease, it's quite important, and this report is so important because in this particular country, there are so many people going into pharmacies with symptoms of STIs or perceived symptoms of STIs, and they're just given drugs, which they take. Maybe if I've met ladies or gentlemen who have taken drugs. Usually for gentlemen, it's a little bit different because their symptoms are a little more instant, that they rush into hospital and they get treatment.
It goes back to the fact that men, as you say, some could be, he could be carrying it. You have no idea. He seems well. The woman is the one who seems to, on the other hand, start to have all these different symptoms.
Surprisingly, men can hardly carry it, minus knowing. Because if a man had sex with a suspicious lady, sorry to use such a statement.
How do you characterize someone who's suspicious?
When we are looking at, for example, if a gentleman comes into hospital with symptoms, some of the questions that we ask is, when did you last have sexual intercourse? And who did you have it with? If I'm married to Rita, so to speak, and we've been together, and then on this one Saturday night, I go out with another person, and then I get symptoms after 2 days, chances are that it's usually a little more obvious for the men. Now, the women don't have that kind of privilege. Maybe we should have even said that, much as we say that STIs are sexually transmitted, people get this disease also in other routes, not just sexual intercourse. So, for the women, they may have these STIs, but with no overt symptoms. In a sense that a woman can have gonorrhea or chlamydia infection in their private parts, but with no overt symptoms. It's a little bit different for the men, because when a man because the man has one organ which is used for urination and sexual intercourse. Ladies, much as the men don't know, where they have sexual intercourse is not where they urinate from. So at times they may have a sexually transmitted infection with no symptom. For the men, it's a little bit different. And the biggest challenge that we get is that men treat themselves and they don't inform the ladies that could have given them that particular infection. You know,
sexually transmitted infections, I think the fact that it's something to do with sex, it is not something that people love to talk about, especially when they're infected. It's more of a personal thing. No one wants to come out in the public and say, hey, you know, I picked up this. It's always something that is quiet. But there is one thing that I have noticed. The ladies take it very, very serious. As soon as they pick up an infection, as soon as they realize they've picked up something, they rush and get help. The men treat it differently. Do you think that could be the reason as to why the number of infections has gone up? And probably you can add this into that. Do men, is there a chance that men are carrying these infections and are more prone to spreading these infections than the women? Because the women rush to the hospital and take care of it. The men, we are like,
I think that brings in a couple of issues. One is, like I said, when you look at a global report, it's good to localize it to understand your issues better. What we see today is, actually, when I was just talking about this issue with some of my friends, we were wondering whether it is the population that is going up, or it is the sexual activity that is going up, or the two working together. That as a gentleman, I have so many people to have sex with, or it is the sex causing. So it's more or less of a relation, cat and mouse. But in this part of the world, you realize that yes, the population is going up, but we also can have huge levels of poverty and unemployment, and reduced ages of what we call sexual debuts, the earliest at which someone has sex. Usually we see that if someone has sex at age 9, they will usually have a lot more sex in their adolescent years than someone who starts it at 25. So since we see a lot of sexual activity, we see maybe a lot of increase in promiscuity. increasing fornication, people having sex with a number of partners, partners that maybe they don't even, because when people go to clinics, even if they are going to have sex tonight, the things they focus on are maybe HIV. Maybe that's why HIV is a little more concerned. No one ever wonders if someone has a vaginal or a penile discharge. No one ever wonders if someone has a wound or whatever. And for the people who try to have sexual intercourse in the dark, maybe we'll never see this. So those are some of the issues
Usually
that
happens in the dark, my friend.
it depends on how you choose to have it. But maybe if you had a little bit of a keen eye, a high index of suspicion, depending on who you're going to sleep with, because not to stigmatize people, but there are what we call most at-risk populations in medicine, especially people who use drugs, people who sell their bodies, and all these guys. These are guys that maybe may have a high risk of having STIs, but because you realize that people are having 5 sexual partners, but they will never have any symptom. So it's important to understand who we are talking to, and everyone to understand how their sexual life is moving, to understand how you're going to prevent the STIs.
Now, Doctor, one thing you mentioned is also our population. And one thing that, I don't know if you've had this before, but someone would rather have an STI, an STD, or HIV than actually end up pregnant. So talking about what society reveals as serious, because when we get into it, I wanted to ask you what the long-term effects of this are. If I keep going to the counter and buying drugs at a pharmacy, every time I don't feel well, I could end up carrying gonorrhea and have a child, and I will transmit it to the child, among other things. But our society not even being afraid of STIs. Like maybe we are having a conversation now and someone is saying, there's a drug for this. That can't be my problem. At least I'm not walking around with a child. Yes.
Yeah, I think you raised a very important issue, but I touched it when I touched on it when I was starting. That it's important for someone to understand what they are having, because many times someone says they don't have just because they don't know. And right now, as we speak, there are so many people are on maybe 4 types of antibiotics for just a symptom with no clear diagnosis. And there are so many today. Almost everyone is a health worker, everyone is a doctor. So some people call, I have such and such a thing, what do you think I should take? So our population is so much into what should I take, not what do I have. And that's where we get the problem. So much as the infections may be increasing, we're also having a problem of resistance and even the wrong diagnosis. But to go back to your point of are people more afraid of infections rather than more afraid of pregnancy, maybe on another day we shall discuss the overt abuse of emergency pills and all these other things, because people are so much worried for life about pregnancy. But you realize that people do most of these things so that they can enjoy the unprotected sex. So unprotected sex is more or less more common today than you almost won't preach condom use to some people. But you didn't realize that as you have this unprotected sex, you're equally getting all these other things. Plus, and you realize that we say that the men can have the complications of the STIs. For example, like blocked tubes. A blocked tube, by some people think that it's only women that have tubes, but the tube that transmits semen in men, which is the same tube that transmits or moves urine. In the women as well, there may be complications. So the challenge that we're having, all the things that you're talking about, the biggest problem they bring us is that it affects health-seeking behavior. If you think what you know is what it is, then it means that you will not be proactive in going to hospital, making this diagnosis well in time, and also preventing the big problem of transmitting to others. Because if you could treat an STI in yourself, even if you had 10 sexual partners, it may perhaps never get to them.
Okay.
Doctor, this is the reason why I don't like talking to doctors. Is I think the same reason why I never usually wanted to be in the same room with my mother, because honesty comes out and truth. And I'm going to be very honest with you. Even the past weekend, we slightly had a conversation with my jamas on the table. And this goes to do with gonorrhea. It is one of the things that I think God has blessed me. And I keep praying that he blesses me even more, that I never catch it. Because the people that I have heard the stories of those that have got this gonorrhea, man, I don't want to ever tell that story. But now, there is a rumor that there is a super gonorrhea. Yeah.
Now, what happens is all the things that we've been talking about fall into maybe about 3 stages. One, the person that has symptoms, the symptoms that I've talked about, that maybe we may not go deep into them, but they may be either in the private parts or even elsewhere. You can have STIs going into the rectal area, into the oral area, or the mouth area, the throat, depending on which kind of sex people practice. So, like you said, men, we have seen that men, in terms of gonorrhea, but you know that gonorrhea, the symptoms of gonorrhea and chlamydia and trichomoniasis may not be very different, because in a man all you will have maybe is a discharge and maybe painful urination. In women, you may have the same symptoms, but the biggest problem we have is that women think that everything down there is a UTI, because some women don't even know that where they urinate from is not where they have sex from. So women are more affected. Again, I will keep saying this because women are more affected because of that confusion. They don't actually know what is happening to them, and they would rather have drugs given empirically than go and have an examination and see what is happening.
What is
exactly?
Yes.
So they will actually be more at risk of the supergonorrhea. But supergonorrhea, in the sense that gonorrhea is caused by a particular germ that we know. I may not really go that deep into technical terms. And there are drugs that we have always known to treat gonorrhea, or to treat chlamydia, or to treat syphilis, or to treat trichomoniasis. But what happens is, because people are taking drugs before any form of diagnosis or in a form of self-medication, it means that you end up taking some, for example, some ladies have, or some gentlemen have something as simple as candidiasis, which requires a fungal drug, an antifungal drug, sorry. But they will go to the pharmacy and they're given metronidazole, azithromycin, and cefixime, and all these other antibiotics, which they don't need at that particular moment. Meaning that the next time they get an infection, which those drugs are supposed to treat, it will never work on them. So some ladies or some gentlemen who have these infections, they don't even get a chance to go and maybe if they have a discharge, go to the lab, have the discharge checked and see which particular organism you have, which drug it reacts to, and which one is resistant. So that you take the particular drug that you need, instead of thinking that I have all these four, because all these four diseases are treated differently, though they may happen in the same person at the same time, or you may have one of the four. So it's not really advisable to just take drugs because of a symptom, but because you've diagnosed. So supergonorrhea is worrying us all because it takes a couple of years to develop a new drug, and someone will tell you that there is need to develop more antibiotics and whatever, but it will take more than 20 years to develop maybe a new antibiotic. Wow. So it's much better off us changing our practices, both in terms of preventing the STIs, but even in terms of treating the STIs and being more proactive. Today, like I've said, everyone is a health worker. There are some diseases for which no screening is ever done. Like, for example, I don't know when I last saw a patient that has done a chlamydia test.
Out of the blue, without feeling anything.
Even when they go to health workers. So what usually happens is that someone has symptoms and all they do is a urine test, which may be good but may not tell much of the story.
That could be your problem, you as doctors. Because when you have a patient come in and you propose or suggest that they go for a urine test, that is exactly what you are planting something in their brains, that whenever I have such an infection or a feel of this infection, all I need to do is have a urine test. So the next time they come, they're not going to ask for any other test. I think that could be, I'm just saying, don't you think that is a problem with doctors? I think that doctors don't tell people when you come in, if you have this and this, I think we should do all these tests.
Yeah, you know, when I call myself an international advocate for health truths, I hit my side as well. True, there are health workers that are not doing it well. It may be for personal reasons, or it may be for total inefficiency, lack of ability to actually diagnose and treat disease. You know, the reason we spend so many years studying this is not because we love to study for those so many years, but you want to understand exactly. So some people think that because they have a smartphone, because they have an iPhone 10 or an iPhone X, they think that they will log in and then know these are the symptoms, so these are the drugs you take. But it's not as easy as that. We need to dissect it to a point that you have these symptoms. How long have you had it? How are they coming up? Which tests can we do? So, and then which drugs finally can we take? So most of our health workers and our patients start at the end. Which drug should I take?
Yes.
So when the drugs don't work, that's when they finally now try to do a test. Maybe more diseases have come in. So
And I think that's the reason why many times we get these cases at a stage where it's almost you can't treat, or it's now more expensive to treat, because every single time we have a problem, even when I have a problem, the thing, when I call my doctor, I don't explain too much. I'm like, doctor, I have a headache. What should I take? Not, doctor, should I come in for... And even the doctors, when you talk to them, or these health workers, they don't say, well, I think you should come in and we do a full test. They always recommend, I think you should go and get Panadols and or something like that.
This is the problem some of these alternative health workers get with us. So actually, some people think that doctors are against prayers as a form of treatment, or against herbal medication as a form of treatment. But our biggest problem, our biggest concern is, if you deny yourself that first opportunity to know what you have, you've lost it. And there are so many people who walk down to their deathbed because they miss that first opportunity to know what they have. So if you have any symptom, whether you want to take Panadol as you, or you want to go to your pastor or sheikh to pray for you, or you want to take mujaja or whatever, or you want to go Western medicine, irrespective of where you're going to go, what cuts across is you must know what you're treating. If you don't know what you're treating, you've lost it, because what starts as, you start with 4 antibiotics, yet you have candidiasis. So meaning that those antibiotics will actually worsen the candidiasis further. Now when you go back, they treat you now for candidiasis. But now the bacterial ones are now have now also set in, but you're now off antibiotics. So you're going to be in a back and forth movement because of a missed opportunity of making a proper diagnosis. So it has problems to do with the patients ourselves, that we miss that opportunity, but again, we think that we don't need it. Then the health workers, some health workers are not as, maybe, I don't want to say that they're not as good, but they don't go that extra mile to be, to try to be a little perfect in diagnosis and treatment as well.
So doctor, if we're talking about the fact that health workers may not know what exactly they're treating, in comes misdiagnosis. For everyone who's watching at this point in time, what should they look out for when they go to the doctor and say, this is how I'm feeling? Can we carry out the urine test? Can we maybe get a sample? Because I don't think what I have is right. Being able to at least inform the person out there that shouldn't just walk in and get a urine test and leave. Let's step away from social media and web doctors, WebMD. What should they ask for?
Remember, there's a time when I was in hospital and a lady, middle-aged lady comes in and she tells me I can't examine her because I'm the age of her son. So it gets a little bit interesting depending on who we are talking about. Truth be told, STI is a little bit difficult to treat because of where the symptoms are most of the times. If someone, for example, gets symptoms because of maybe oral sex, sorry to say, they may be a little bit shy about them. Some people are having other forms of sex that are not conventional, so to say. So they have symptoms in all manner of areas. So where it starts from is that it starts with the patient being a little more revealing.
Be honest.
Exactly. Because if a patient says they don't have a discharge, or they say they have a discharge but it is blackish, it is brownish, and they don't allow you to look at it, at that point you've lost it. There is no test you're going to do that will diagnose that patient very well. So it starts with the patient. If
even as the patients, we have to be very observant of, what is actually bothering you. Because very many times I have gone to, the doctors, or you are in a queue and, they ask someone what is bothering you, and they are not certain. They just keep saying, that is it. Some of I get so many, because we do a lot of online consultations, I get a lot of messages on WhatsApp. And the challenge I get is that people are so much fixated with what they think they have. They don't even want to have any conversation. Actually, the moment you keep probing further, they think you don't want to help them. So, yes, we must get the symptoms correct right from the beginning. Do not have symptoms and for you think, actually, this whole misnomer of UTI versus STI. So you ask someone, what do you mean by UTI? They don't even know what it means. Or we ask them where the symptoms coming from, especially for the ladies. Sorry, I've hit the ladies a little mad, but they have real issues because they don't even know where the discharge is coming from, where the pain is, or whatever is causing it. So, like I said, these things are a little more related. If a man has a UTI and an STI, it takes a little bit of a doctor must read, or a doctor, a health worker, or a nurse must really be very more observant and very keen to understand what exactly
caused the symptoms. Many times we start with the symptoms and treat, but we need to know if you had the symptoms, how long have you had them? Which symptoms do you have? Are they in one area of the body or even in other areas? Then after that, if you can, in STIs, it's always best for the doctor or health worker to see. If you have a wound, let a person see. If you have a swelling, let a person see. If you have a discharge, because this can save you unnecessary drugs. This can save you unnecessary tests, because if you have a discharge, all you need is us to take off a sample of the test, take it to the lab, see which organisms are there, if any,